Anita Krajnc, are you here? Yep, have a seat. You have 5 minutes to depute before the board.
Thank you for the opportunity to speak to the Board of Health. I just want to acknowledge former late Councillor Jaya Robinson, who endorsed the plant-based treaty, and I just wanted to say, thank her for that and rest in power. So my name is Anita Krajnc. I'm the Executive Director of the Plant-Based Treaty. Our goal is to have a global plant-based treaty that would allow us to align with the Paris Accords by addressing food systems. A second goal is for cities and other institutions to take action, and we have 5 programs. The first is we collect endorsements from individuals, groups, businesses, and cities to put bottom-up pressure for a global treaty. Our second program is a cities program, and 30 cities have endorsed already, including 3 European capitals, Amsterdam, Edinburgh, and Belfast. A number of cities in India, LA has endorsed as well. Third program is menu change and education. Fourth program is we have UN observer status. We go to the global climate talks and we produce the report. They're called Safe and Just, and it uses donut economics, including, the interim includes health as one of the UN Sustainable Development Goals. And finally, we have trainings to build capacity. I'd like to share a report, some of the findings of a report from Dr. Zahra Kassam. She organizes an annual plant-based nutrition conference, and there was just one on Saturday, and had Dr. Clapper speak. He's one of the foremost doctors that advocate plant-based food. And her sister, Dr. Shireen Kassam, organized the first plant-based nutrition conference in UK, and proposes a fully plant-based guide. So I'll just go over some of the findings. The first is the increasing burden of chronic disease in Canada. In 2022, 30% of adolescents aged 12 to 17 years were overweight or obese. A second issue is health has negative consequences on the Canadian economy. The Chronic Disease Prevention Alliance of Canada reported that $190 billion annually are the costs in terms of indirect income and direct health costs. Third point is diet is a leading risk factor for mortality globally and in Canada. Globally in 2017, dietary risks were responsible for 11 million deaths. Importantly, poor diets account for more deaths globally than tobacco. Specifically in Canada, in 2016, the 5 leading risk factors for mortality in Canadians were diet, tobacco, high blood pressure, high fasting plasma glucose, and high BMI. Fourth point, plant-based diets are important for the prevention, treatment, and reversal of chronic disease. We have decades of data supporting the role of plant-based nutrition in the prevention, management, and in some cases, reversal of chronic diseases, including cardiovascular disease, diabetes, obesity, hypertension, and cancer. Fifth point, international organizations and medical clinical guidelines support a plant-based diet for prevention and management of chronic disease. For example, the American Diabetes Association's consensus on nutrition therapy for diabetes and pre-diabetes acknowledges that vegetarian and vegan diets are beneficial for the prevention and treatment of diabetes. Next point I'd like to make, sixth point, our Canada Food Guide supports a plant-based diet to promote health of Canadians and greater adherence to the Canada Food Guide. In 2019, the guide supports a plant-based diet. If we look at the plate, half the plate is with fruits and vegetables, a quarter is whole grains, a quarter protein, of which at least half should be from plant sources. This makes the plate at least 87.5% plant-based. So I think it's very essential that all our food that the City of Toronto is responsible for in shelters, old age retirement homes, and early childhood education should be plant-based. I believe fully plant-based. Another point is South Asian people have higher rates of cardiovascular disease and diabetes. And this disproportionate higher rate of diabetes on average means that also that they develop these conditions 10 years earlier than other racial and ethnic groups. The next point I'd like to make are dairy concerns. The current Canada Food Guide has removed dairy as an essential food group and has recommended that water should be the beverage of choice. And then just a couple of points on diabetes. All animal foods are associated with an increase in the risk of diabetes, including eggs. So finally, I'd like to say that I'd ask just that the board introduce a motion to endorse the plant-based treaty. Thank you.
Thank you. Any questions for the deputant? Seeing none, thank you for coming in today.